Have you ever noticed a strange feeling in your body? Something you couldn't explain, but deep down, you knew it wasn't right? Maybe it was just a passing ache, or maybe it was your body whispering something urgent. You see, not all signs of danger come screaming. Sometimes they arrive quietly, subtle, disguised as everyday discomforts. But ignoring them could cost you everything. Doctors have long known that certain symptoms in people over 60 are not just signs of aging. They're warnings. Warnings that something inside you may be failing, slipping out of balance. In fact, they may be the final red flags before something irreversible happens. In today's video, we're diving into 7 silent but deadly signals that most people overlook until it's too late. From sudden breathlessness that creeps up while you're sitting still, to sharp chest pressure that feels like a weight pressing down on your soul. These aren't just symptoms. They're your body's desperate cry for help. But here's the thing. You can still take control. The power is in knowing what to look for and acting fast. And if you stay with me until the very end, I'll share one final warning that's often missed, yet it's one of the most dangerous signs of all. It could be the clue that helps you or someone you love avoid a tragedy. So before we dive in, take a deep breath. Get comfortable. Maybe grab a warm cup of tea or your favorite coffee. This might just be one of the most important conversations you've had this year. And hey, if you've ever thought to yourself, these little things I feel, could they mean something bigger? Then you're in the right place. I'd love to hear from you in the comments. Just write, I will never ignore the signs. That one sentence might just encourage someone else to listen to their own body. Also, don't forget to like this video, subscribe if you haven't already, and turn on the bell so you don't miss what could be life-saving knowledge next time. Ready to discover what your body might be trying to tell you? Let's begin. Number 1, unexplained, crushing fatigue. There's a world of difference between feeling a bit tired after a busy day and the kind of exhaustion that hits you like a heavy fog and never lifts. If you wake up after a full night's rest and still feel completely wiped out, if simple everyday tasks suddenly feel like climbing a mountain, that's not just fatigue. That's your body waving a red flag. This isn't the kind of tiredness you shake off with a coffee or a quick nap. It lingers. It drags you down quietly day by day. You might have once taken morning walks, tended your garden, or enjoyed cooking for the family, but now you find yourself breathless just walking from the bedroom to the kitchen. Even getting dressed or holding a conversation feels like too much. And here's the truth. This isn't just getting older. It could be your heart, your kidneys, or another vital system struggling to keep going. Sometimes when the body begins to shut down to conserve energy, overwhelming fatigue is the first and loudest symptom, if only we listen. Doctors see this kind of exhaustion again and again in patients with heart failure, late-stage cancer, or kidney disease. When your body is running on empty, just keeping you alive takes everything it has. And when that happens, fatigue doesn't just become annoying, it becomes dangerous. One of the most alarming clues? When this fatigue comes out of nowhere, or gets noticeably worse over time. If you once felt vibrant and energetic, but now feel like you've been drained from the inside out, with no obvious reason, that's the moment to stop and listen. So what can you do? Start by tracking it. When did it begin? What makes it worse? Is it keeping you from doing things you once loved? If the answer is yes and it's progressing, it's time to see your doctor. The sooner you act, the greater the chance you'll catch what's going on before it spirals into something far more serious. And hey, if this reminds you of someone you love, don't keep it to yourself. This information might save them. Go ahead and share this video with someone who needs to hear it today. Sometimes all it takes is one message to change or even save a life. Number 2, sudden and crushing chest pain. There is one sensation your body gives you that should never be ignored. Imagine a heavy pressure pressing down right in the center of your chest, tight, unrelenting, as if someone is squeezing your heart in their fist. If this pain comes out of nowhere, especially if it spreads to your arm, neck, jaw, or upper back, you might only have seconds to respond. Doctors are clear, this kind of chest pain is often the final warning before a major cardiac event, like a heart attack, or something even more catastrophic. like an aortic dissection. And yet, so many people brush it off. It's probably just heartburn. Maybe I pulled a muscle. But here's the truth. When doctors hear that description, they don't wait. They act. Because hesitation, even for a moment, can be the difference between life and never getting another chance. The most dangerous kind of chest pain isn't always sudden or sharp. It might begin subtly, like a dull ache, and build slowly. Or it might hit you all at once, like a hammer to the chest. Either way, it's your body screaming at the top of its lungs. Something is deeply, dangerously wrong. And forget the dramatic movie heart attacks. Real ones can feel different. Sometimes it's just a discomfort in your chest, a strange pressure in your upper body, paired with nausea, dizziness, or cold sweats. And when the pain feels sharp, tearing, like something is ripping from the inside out, that could be your aorta rupturing. It's one of the most deadly emergencies known in medicine. Internal bleeding begins instantly, and without immediate surgery, survival is nearly impossible. So what should you do if you ever feel sudden, severe chest pain? Don't wait. Don't lie down. Don't assume it's anxiety or stress. Don't hope it will pass. Pick up the phone and call emergency services immediately. The faster you act, the higher your chances of survival. Every minute matters. Every second counts. And listen, if you've ever felt this or know someone who has, don't keep silent. Hit that like button if you find this valuable. Subscribe and turn on notifications so you never miss the warning signs again. And if you believe in the power of spreading life-saving knowledge, feel free to support us with a super thanks. It helps us keep making content that truly matters. In the comments below, write, "I won't ignore the pain." Just one line, but it could help someone else realize it's time to listen to their body. Now let's keep going. The next sign is silent, deadly, and it might already be affecting you without you even knowing it. Stay with me. Number 3, difficulty breathing or sudden shortness of breath. Picture this. You're sitting quietly in your favorite chair. The house is calm. You're not moving, not exercising, not doing anything that should make your heart race. But then, out of nowhere, it hits. You can't seem to get a full breath. It feels like the room is losing air, like someone turned off the oxygen, and no matter how deeply you inhale, it's just not enough. This isn't just discomfort. It's your body sounding an alarm, a very serious one. Doctors warn that unexpected shortness of breath is often a sign that something critical is starting to fail. And what's terrifying is that it doesn't always come with warning signs. One moment you feel fine, the next, you're gasping for air. This could be the sign of advanced heart failure, where your heart can no longer keep up with the body's demands and fluid begins to back up into the lungs. Or worse, it could be a pulmonary embolism, a blood clot that has silently traveled through your body and lodged itself deep inside your lungs. What's chilling is that it often begins with nothing more than a slight tightness in your chest, a strange sensation that maybe you slept wrong or you're just feeling a little off. But then it builds, and suddenly it feels like you're drowning without water. There's also congestive heart failure, where your heart can't pump properly and your lungs begin to fill with fluid. Breathing becomes especially difficult when lying down. Some people wake up in the middle of the night, gasping, heart pounding, drenched in fear. And don't forget about the silent heart attack. No crushing chest pain, no dramatic collapse, just overwhelming breathlessness, nausea, cold sweats, and a fatigue so deep it feels like your body is shutting down. Many people don't even realize they're in the middle of a heart attack until it's too late to stop it. So what should you do? If you ever feel short of breath for no clear reason, especially if it comes on suddenly, don't wait. Sit down, stay calm, and seek medical help immediately. If it's a blood clot, heart issue, or lung condition, every second you wait makes it worse. Acting quickly could mean the difference between walking out of the hospital and not walking out at all. And if someone you care about has had this experience, don't let it go unnoticed. Share this video with them. It might be the nudge they need to finally pay attention to what their body's trying to say. Now take a breath. We're just getting started. The next warning sign is one many people welcome at first, but it could be one of the most deceptive and deadly of all. Number 4, rapid, unexplained weight loss. At first, it might feel like a blessing. Your pants fit looser, the number on the scale is dropping, and people start saying you look thinner. But what if you haven't changed your diet? What if you haven't exercised at all, and yet the weight is falling off like sand through your fingers? Doctors warn, if you're losing weight without trying, your body might be trying to tell you something far more serious. Especially in older adults, this kind of sudden weight loss is rarely harmless, and often points to a major disease working silently from within. One of the most alarming causes is cancer. Some of the deadliest forms, pancreatic, lung, and digestive cancers, can cause your body to burn through calories at an abnormal rate, long before any other symptom appears. The cancer hijacks your metabolism, draining your strength and stripping away fat and muscle, leaving you weaker, frailer, and dangerously fatigued. But cancer isn't the only threat. Unexplained weight loss can also signal undiagnosed diabetes, severe metabolic disorders, or congestive heart failure, where your body struggles to absorb nutrients and begins to break itself down from the inside out. And there's more. Chronic inflammation and hidden infections can wreak havoc quietly. When your immune system is in overdrive, it burns energy rapidly just trying to fight. Conditions like tuberculosis, autoimmune disorders, or long-term infections can trigger a slow, steady wasting away, one you barely notice until it's gone too far. So how do you know when to take it seriously? If you've lost more than 5% of your body weight over a short period, without dieting, without working out, don't shrug it off as age or stress. That's a red flag waving in plain sight. Schedule a full checkup. Get blood work. Ask hard questions. Push for real answers. Because the earlier you catch what's wrong, the better your chances of stopping it before it becomes something you can't reverse. And hey, if this resonates with you, if you've been quietly concerned about that number on the scale, or if someone close to you seems to be shrinking before your eyes, don't ignore it. Hit that like button if this content matters to you. Subscribe for more life-saving insights. And if you want to support the channel and keep these videos coming, consider tapping that super thanks below. It means the world to us. In the comments, just write, "I choose to take my health seriously." That one sentence can spark someone else to pay attention to what their body's been trying to say all along. Let's move forward. The next sign affects your mind, and often arrives when no one, not even you, sees it coming. Number 5, sudden confusion, disorientation, or unexpected changes in personality. There's something deeply unsettling about feeling like your own mind is slipping through your fingers. Maybe you, or someone you love, starts forgetting simple things. Losing track of time, acting distant or agitated, or saying things that just don't seem like them at all. It might seem subtle at first, harmless, just a bad day or senior moment. But when those moments become more frequent or strike out of nowhere, it could be your brain sending an urgent distress signal. Doctors warn that rapid mental changes are often signs of a serious neurological problem. In some cases, it could be the early stages of a stroke, a brain infection, or a progressive brain disorder that's already underway. A stroke, for example, can cause a sudden wave of confusion, slurred speech, unsteady movements, or an inability to recognize faces or places that were once familiar. Some people even experience short episodes where they seem off for just a few minutes or hours, and then snap back to normal. But make no mistake, that could be a transient ischemic attack, also known as a mini-stroke, and it often precedes something much worse. Infections are another hidden threat, especially in older adults. Conditions like urinary tract infections, pneumonia, or sepsis can quietly move through the body and hit the brain fast, causing sudden delirium. The person may seem agitated, confused, or emotionally disconnected, like they're not fully there. This is not just aging, it's a serious medical emergency. And of course, we can't forget about Alzheimer's disease and other forms of dementia. While these conditions typically progress slowly, there are cases where the decline is shockingly sudden. A once sharp mind can begin to unravel overnight, forgetting names, places, daily routines. Tasks that were second nature become impossible puzzles. One of the most dangerous mistakes people make is thinking, "That's just old age." But when mental function declines quickly, that's never normal. It's usually the brain reacting to something that needs immediate attention. So what should you do? If someone you love suddenly seems off, lost, confused, irritable, or mentally distant, don't wait. Don't assume it will pass. Get medical help immediately. Whether it's a stroke, infection, or something deeper, acting fast can save not just memory, but life itself. And if you've seen this happen before, or if it's happened to you, don't stay silent. Sharing this video could help someone recognize the warning signs in their own loved ones before it's too late. You never know who needs this message. Let's keep going. The next warning sign may seem physical, but it can strike with devastating consequences, often in silence. Number 6, severe and unrelenting abdominal pain. At first glance, a stomach ache might not seem like anything serious. Maybe you blame it on something you ate. Maybe you wait it out, hoping it will pass. But when the pain is deep, sharp, or refuses to go away, it could be far more than just indigestion. It could be a ticking time bomb inside your body. Doctors caution that intense, persistent abdominal pain, especially when it comes on suddenly or lingers for hours, may be a clear sign that something inside is starting to break down. One of the most dangerous possibilities? A ruptured abdominal aortic aneurysm. That's when a weak spot in your aorta, the body's largest artery, suddenly bursts, flooding your body with internal bleeding. And when that happens, you have minutes, not hours. Minutes. This kind of pain is often described as deep, crushing, and relentless. It may radiate through the stomach, lower back, or sides, sometimes even pulsing with every heartbeat. If you feel this, don't wait. Immediate emergency care is the only lifeline. But there are other killers that hide behind abdominal pain. One is intestinal ischemia, a condition where blood flow to your intestines is suddenly cut off. It can happen due to a twisted bowel, a dangerous clot, or even advanced cancer. If your abdomen feels swollen, hard, or unusually tender to the touch, especially if you haven't had regular bowel movements, that's a red flag. Another silent threat? Pancreatitis, an inflamed pancreas that can cause intense, stabbing pain in the upper abdomen, often radiating to the back. It can start without warning and worsen after meals, making even small bites unbearable. If left untreated, it can spiral into organ failure, fast. And let's not forget the gallbladder. When it's inflamed or blocked by stones, it can trigger sharp, stabbing pain under the ribs, usually after fatty meals. Many people confuse it with acid reflux or trapped gas, but this misstep can lead to deadly infections if ignored too long. So what should you do? If you ever feel excruciating, unexplained, or persistent abdominal pain, especially with fever, vomiting, or sudden weakness, don't wait. Go to the hospital. Some of these conditions require surgery, and in cases like these, every second you delay could mean the difference between recovery and disaster. If you've ever brushed off this kind of pain, or if you know someone who has, now's the time to share this message. You could save a life just by clicking share. If this part of the video helped open your eyes, tap the like button and subscribe to stay informed. And if you believe this kind of life-saving content matters, your support through the Super Thanks feature helps us keep going, reaching more people like you. Let us know in the comments. I won't ignore the pain anymore. Just that one sentence could be the turning point for someone who's been silently suffering. And now, we've saved the most subtle, most easily overlooked, but deeply dangerous warning sign for last. Don't miss it. Number 7, frequent falls or sudden loss of balance. It starts quietly. A small stumble, a strange moment of dizziness. You might laugh it off. I'm just clumsy today. But what if that little trip was actually a serious warning from your brain? Doctors warn, in adults over 60, frequent falls or sudden loss of balance aren't just accidents. They can be the first signs of a major neurological or cardiovascular issue, one that could lead to devastating consequences or even death. Here's why this matters. Falls are one of the leading causes of injury-related deaths among seniors. Not only can a fall cause head trauma or a fractured hip, but it can trigger a chain reaction, loss of mobility, hospitalization, infection, and ultimately, a steep, irreversible decline. But the fall itself is often just the symptom. What's behind it? Sometimes it's a mini stroke, a transient ischemic attack that momentarily disrupts blood flow to the brain. You might not feel anything beyond a little dizziness, but inside your brain, damage may already be starting. In other cases, it could be Parkinson's disease, early-stage dementia, or inner ear disorders that affect spatial awareness. Or it might be low blood pressure, heart arrhythmias, or even a slow brain bleed from a previous unnoticed bump. And here's something few people realize. Just one bad fall can cut a senior's life expectancy in half. Why? Because after the fall, fear sets in. You stop walking, you stop socializing, you stop moving, and your body slowly shuts down from disuse. So what should you do? If you or someone close to you has experienced more than one fall in the past 6 months, or if you've noticed sudden unsteadiness while walking, don't ignore it. This isn't just getting old. It's often the body's final attempt to warn you before something worse happens. Talk to your doctor. Ask for a neurological assessment. Check your blood pressure, your heart rhythm, your medications. Get answers, because your balance isn't just about stability, it's about survival. And if you've experienced this, or know someone who has, share this video with them. It might be the reason they take that fall seriously before it's too late. If you found this insight helpful, tap that like button and hit subscribe. And if you'd like to support this channel in bringing more life-saving content to the community, consider giving a super thanks. We're deeply grateful for your help. And in the comments, write, "I will take every fall seriously." That one commitment might inspire someone else to stand tall and stay safe. Now that we've uncovered all 7 deadly signs, let's wrap this up with something every person over 60 needs to hear. Final thoughts. If you're still here with me, it means something in this video spoke to you. And that matters, because recognizing the signs early is the first step to changing everything. Our bodies are always speaking to us, sometimes in whispers, sometimes in warning shouts. And too often we brush them off. We say, "It's probably nothing," or "I'll deal with it later." But as we've seen today, those small symptoms could be your body's way of crying out for help before it's too late. We've explored 7 serious signs that could mean your health is in real danger: sudden fatigue, crushing chest pain, breathlessness out of nowhere, unexplained weight loss, mental confusion, severe abdominal pain, and even frequent falls. These aren't just part of aging. These are signals, warnings, opportunities to act before crisis strikes. The truth is, as we get older, our health can shift in a heartbeat. But here's the good news. Knowledge gives you power. When you understand these signs, you're no longer in the dark. You're in control. You don't have to live in fear. You just have to stay aware. And I want to hear from you. Have you ever experienced any of these warning signs? Or has someone close to you gone through one of them? What happened and what did you do about it? Your story might help someone else recognize a symptom and take action just in time. In the comments below, write, "I will never ignore deadly symptoms again." That simple sentence might be the nudge someone else needs to pay closer attention to their own body. If this video brought you clarity, hope, or even a bit of strength, please tap that like button, subscribe to the channel, and turn on the bell so you never miss a message that could protect you or someone you love. And if you believe in spreading helpful, life-saving content like this, consider supporting us with a super thanks. Every bit of support helps us bring this information to more people who truly need it. We're just getting started. In upcoming videos, we'll be uncovering more silent symptoms, healing tips, and powerful knowledge that can help you live stronger, longer, and more independently. But I'd also love to know, what would you like us to cover next? Drop your ideas in the comments so we can serve you even better. Because you deserve answers, you deserve clarity, and most of all, you deserve a life filled with strength, purpose, and peace. Thank you for spending this time with me today. Take care of yourself, and I can't wait to see you in the next video.